Dr. Gerayli with us from Spinal Pain Specialist. Welcome, doctor. Good to have you back on the program.
Thank you.
Brought along one of your patients today.
Yes, Marianne was kind enough to join us today to speak a little bit about her condition.
Great.
As we talk a little bit about scoliosis today.
All right, Marianne Luback, good to have you on the show. Welcome to Channel 6 today. Thanks for coming by today. So we're going to talk about that situation, degenerative scoliosis, and just real briefly, what is it, doctor?
Well, scoliosis, as you know, is curvature of the spine. There are several reasons why people develop scoliosis. You've probably heard about childhood scoliosis, which is idiopathic. That means that the reason for children who develop scoliosis is unknown. A lot of it is genetic, and they grow up to continue to have this curvature. In adults, however, we see scoliosis that occurs for a number of reasons. One of those reasons is degenerative disc disease. As you can see, the curvature occurs because the discs in between lose their integrity, the stability of the spine is lost, and therefore spine becomes unbalanced. In females over the age of 40, osteoporosis plays a significant role. And when the bones become more brittle, you also lose the stability of the spine, and as a result, you develop this unbalanced spine.
We're looking at an x-ray here. Is that your prime diagnostic tool? Obviously, a person comes in complaining, and maybe you take a look at the back, and just the way it's aligned, you can probably tell based on your experience, but the x-ray confirms it.
In mild cases, sometimes it's difficult to see it. You can sometimes feel it when the patient bends forward. You can feel their spine and feel the curvature. In moderate to severe cases, obviously, it's very easy to observe it in a patient with their shirt off. You can see the curvature. You can see the difference in the symmetry of the pelvis or the shoulders, and that gives you the clue. But the gold standard is plain X-ray films that show the curvature.
What would the person, type of symptoms might they experience?
Typically, in mild cases, patients don't really have any pain. It's not really a painful condition when it starts. The curvature by itself may lead to some musculoskeletal discomfort from time to time, but it's really not a painful condition until it gets to the point where it starts to cause narrowing of the spine, and the curvature becomes so severe that the nerves are also irritated, and patients can have not only back pain, but also pain that radiates down into their legs.
Marianne, share a little of your experience. Were you having some of those kinds of symptoms?
Yes, I was. I really was having a hard time walking any distance, and also hard to breathe.
Okay, so when it gets to that level, people start really noticing the effects, and maybe something that you may have had for years, but it had gotten progressively worse, and
correct.
We get to get it looked at.
Marianne mentioned that it was hard for her to breathe.
Right.
The reason that happens is because when the curvature increases to the point where it starts to really impinge on the way your thoracic or chest wall expands during breathing, it becomes hard to really get that full expansion and fill your lungs.
All right, so she was having these problems, having these symptoms. She came to you. Treatment, how did you handle this particular condition?
The one thing that was bothering her the most was her inability to walk properly, and that was mainly because the curvature had reached a point that the nerves that go down to the leg were being affected. So there was so much impingement on the nerves that she was having a lot of inflammation of the nerve roots. So what she does is she comes in, and her treatments consist of placing anti-inflammatory medications under X-ray directly next to the nerves as they exit from the spine at the level where the curvature is the worst. And by reducing the inflammation of the nerves, her leg pain improves, her ability to walk improves, and she can
and I think
be
we can tell
happier.
she's a happier person. And those treatments
Yeah.
have been successful, it sounds like.
Very successful, thank you.
Right. What is your ability? How has your ability changed? Are you able to walk a lot more now and do more things?
Yes, I am able to. Before, well, 10 years ago, I was a mall walker, and I had to give it up because I just couldn't do it. Well, I can walk again now
Good.
with
Great.
my husband. And
You're back in the mall. Or wherever you want to walk. That's super.
Right.
That's great. Now, this is one treatment option, would be the application of pain medication specifically located in spots. I guess there'd be other alternatives as well. Surgery possibly in extreme cases?
In extreme cases, like any other condition, obviously you start with the most conservative treatments. In mild to moderate cases of scoliosis, simple physical therapy, sometimes back bracing, strengthening exercises, and so forth are adequate to maintain a certain level of stability of the spine.
Right.
You follow that with anti-inflammatory medications and sometimes pain medications for comfort. In cases where all of the conservative treatments, including some of the injection treatments and so forth, fail, surgery may be an option. However, surgery is involved and it requires various instrumentations, rods and screws. We may have a picture.
I think we have a picture on the screen here of how you've done that. Is this
this is just a picture of the scoliosis.
That's the before, really, with just an artist enhancement on the right.
Right.
So I believe we have a third picture that might show what we're talking about. There's the hardware we're talking about.
That's the hardware. So rods and screws to bring the alignment back, and that's obviously a large operation.
The big, most extreme measure, yeah.
Correct, and it's reserved for patients who have failed all conservative treatments.
Well, again, a variety of treatments options are available, from the mild, somewhat conservative to a little more invasive, I guess, much more invasive with surgery there. But whatever your level of discomfort would be, that's your first step, is to get it taken a look at, and you'll help determine what exactly is the problem, and then
proper
the treatment
diagnosis.
program. And you'll be like Marion and be able to walk the malls and whatever else you want to do. Sounds like good information. Again, if people want to find out more about what's available, you can give them a call at 297-3838. Now, you deal with all kinds of levels of conditions and pain. Marion,
Correct.
one example, kind of a moderate, middle of the road situation, not as extreme maybe as the surgery we're seeing here.
And patients may elect to treat their condition non-surgically. Not everybody has to have surgery unless they have neurologic deficits or they're losing certain functions. They can still treat it medically with medications and so forth, just to keep it under control.
And as you've told us in previous segments, there's a variety of options available, different ways, different things, along with physical therapy and exercise, as well as the right medications can also help as well. So
absolutely.
Again, a wide range of treatments. So if you have a pain in the back or discomfort or have trouble walking or breathing, it all may be related to your spine. You can check it out over there at the Spinal Pain Specialist Medical Corporation. Dr. Gerayli and his good staff will be happy to talk with you, and you'll be like Marion, be a very happy person, being able to get around and enjoy life more. Thanks for both of you for being with us in the program today. See you back here in a couple of weeks, Doctor. Thanks for coming by today.
Thank you.
And we'll see you folks in a few minutes with more right after this time out. Stay with us.